Joria, and I'll be your nurse for this evening. Can you please state your date of birth and your name for me? Okay, Mrs. Smith. Let's check your doctor's orders. Okay, we have a urinary catheter insertion today. And with that procedure, we're going to insert a tube into your urethra, and it's going to go to the bladder. And it's going to be connected to a collection bag where we can get specimens if we need to. And it's the procedure is to help with any distension or discomfort you may feel. So I'm going to begin the procedure. I'm going to lift your bed. Do you have any allergies I should know about? Any allergies to betadine, iodine, or latex? Okay, none. All right. I'm going to get some gloves. And I'm going to begin with perineal care. So I'm going to need to lift your covers and your gown for the procedure. Okay, Mrs. Smith, I'm going to lift your gown. I'm going to lay this towel down and perform perineal care. Making sure to use a different corner with each stroke. I want to clean the outside labius, and then I'm going to clean the center. And then I'm going to discard of these towels in the proper linen cart. Okay, I'm going to get started here. When doing this procedure, a male patient would be in a supine position with their thighs slightly apart, and a female will be in a dorsal recumbent position. And for the sake of the video, we're going to keep the patient in a supine position with their thighs slightly apart. I'm going to keep this bag for a trash bag. I'm going to come over here to perform my sterile gloving technique. I'm going to discard of this. It's not very useful. I'm going to lay this sheet down with the water resistant side down in order to expand the sterile field. My tubing out, and I'm going to remove the cap from the syringe and insert a little water just to make sure that the balloon inflates properly, and it does. So I'm going to pull that back out, making sure I still have 10 cc's available for the procedure, and I'm going to leave the syringe here. I'm going to remove the cap from the lubricant, insert some, and leave the tip of the tube in the lubricant, 2 to 3 inches. I'm going to get the iodine solution and put it here in this reservoir and discard of it. And I'm going to begin perineal care. I'm going to clean the labia and discard. Do the other side the same way and discard. And then I'm also going to clean the center. And then I'm going to discard it. I'm going to get the tube out and insert it with the syringe still attached. I'm going to insert it into the patient's urinary meatus. I'm going to insert it 3 to 4 inches. And then I am going to make sure I'm still holding it securely while I inflate the balloon with 10 cc's of water. Once I'm done with that, I will remove the syringe and discard of it. And then I will pull back until I meet resistance. I will securely tape it to the patient's inner thigh. I'm going to take the patient's collection bag and hang it on their bed frame, making sure it stays beneath the patient's bladder level. Then I'm going to gather up all of the equipment used and discard of it properly. If a specimen needs to be collected, then we can take the specimen from the urinary collection bag because the catheter was just inserted. But after 5 minutes, I will have to use the urinary port. I'm going to ask the patient, do they feel any major discomfort or pain? None is noted. So I'm going to cover my patient back up, maintaining their privacy. I'm going to lower the bed. And I will be back to check on the patient later. Hi, good afternoon. I'm Joria, and I'm here to be your nurse for today. Can you please state your name and date of birth for me? Okay, Mrs. Smith. I'm going to check your doctor's order for a second. Okay. Today we're going to be removing the urinary catheter that was inserted. I'm going to lift your bed. I will have to lift your covers and your gown for the procedure. We want to get the gloves. Are you feeling any pain or discomfort? Okay. I'm going to lift your gown now. Okay. First, I would empty the patient's collection specimen bag, and then I would make sure I do so while keeping it below the level of the bladder. Now that that is done, I will hold the tubing and remove the tape, and then I'm going to remove the 10 cc's of water from the patient's balloon. Once I am sure that I have pulled out the entire 10 cc's, I will remove the syringe and discard of it. I'm going to ask the patient to take a deep breath for me while I remove it. And then I'm going to discard of it properly. I'm going to pull the patient's cover down. Ask them, do they feel any pain or discomfort? Is everything okay? And then I am going to lower their bed and document the procedure. Thank you.